So the question therefore becomes, what do you do about the 80% of patients who don't have EGFR mutations, who have wild type EGFR? And as one example of trying to target those patients in particular is with a compound that we're going to be working with called Sym-004. And what that is actually a combination of two different antibodies and within the same bag, the same infusion bag. And the reason for that and the advantage for that is because you have two different antibodies that target two different places on the EGF receptor. You can then cause more cross-binding of the epidermal growth factor receptor. And in doing so, that makes it internalize into the cell and thus degrade quicker. And so we're very hopeful that this might be one approach for patients who don't have an EGFR mutation. So Sym-004 is a drug which is being tested in a phase 1 clinical trial for patients with advanced non-small cell lung cancer patients. And what it is a combination of two different antibodies. And these two different antibodies target two different places on the EGF receptor. And the drug has been tested in early studies in colorectal cancer. And in colorectal cancer, patients don't have an EGFR mutation. They just have too much EGFR, overexpression of the EGFR. So this drug has been tested in colorectal cancer patients who don't have an EGFR mutation, and has been tested in these patients who have already failed standard EGFR antibodies, such as cetuximab. And in about half of those patients, they had some benefit to Sym-004.